to restart. Allow accessory سنة لحظة. Allow. هنعمل restart. ها؟ لا مش موجودة هنا. طيب في عندك فلاش ننقلها على الكمبيوتر التاني؟ تايب سي او فلاش عادية. طيب نعم. طيب حطها هنا. طيب انا ممكن ابتدي اتكلم على طول حتى من غير.
Since we have a few minutes, I have a question to Dr. Ahmed. Dr. Ahmed, I had a case, I did pulmonary AVM, which is simple, straightforward, and then I did the clot. But 2 days after that, the patient had stroke, and proven by MRI, it was minimal stroke, and I have no explanation why it happens 2 days after the procedure. فما أدري دكتور أحمد إذا عندك
So this, very difficult to. It's very difficult to say whether this was related. But
شوف شباب
this. It's too difficult to say whether this is related to the technique itself, since it happened 2 days after. Maybe it happened during the technique, but later on it. But most of the causes of stroke happening after the procedure is either related to the procedure itself, or it is because there's another AVM.
So could it be because of the thrombus that caused in the venous aneurysm sac can go and migrate?
Yes,
when
that's
you
right.
close the artery, and there's a thrombosis in the venous sac, does it?
Yes, and I'm going to tell you something else that might cause this actually. If you are putting the coils very slowly, so when you put the first coil, the thrombus starts to form on it, but there is still flow, so it can carry that thrombus systemically. So that's a problem. So I always put the coils ready before I start coiling. Or use a plug, which will only take 1 minute for it to occlude. Thank you.
Samier Jazz? Okay.
Apologies for the delay, technical problems. Okay, To start with, it might be a little bit of a surprise. This is a talk rather than a presentation, and it's mainly about how to succeed in the IR practice, maybe in the IR realm, rather than how to be successful in a specific technique. Why I devised this talk the way that you will see, it's because I want to share some of the lessons learned throughout my experience over maybe more than 20 years in uterine artery embolization. I want to improve our collective and let's say our all IR practice and success in general. And finally, I want to leave a better future for the next generation of IR interventionists. I always consider that your success is my success, and you will see after the presentation why I'm presenting these specific points. These are the topics that I'm going to tackle throughout the talk, and I'm going to start with setting up the service. We'll go through pricing, marketing, a bit of social and communication skills. We'll talk about the procedure itself, some of the techniques that can be used. Although I don't like the word technique, I don't describe IR as a technique. I describe it as a service or a practice. And finally, I'm going to talk about how we can collaborate. To start with setting up the service, maybe this talk is mainly aimed at the younger generation when, I think there is a problem. Yeah. Younger generation who are just setting up the service. You need to prepare yourself with a lot of knowledge, attend conferences, get proper training, have a mentor. Don't just start. Knowing a technique or knowing a procedure does not mean you can do it successfully. A successful interventional radiologist is not the one who knows how to do the procedure. He's the one who's more efficient with less complications. So you need to be aware of that. Prepare yourself very well with knowledge and necessary skills and training. Attend conferences, listen to the other doctors who've started it before you, and make sure you gain from their experience. You need to have a proper clinic setup. When we started, probably when I started in 2004, there were no IR clinics. The concept itself was not there. I think I shared some difficulties maybe with Dr. Shamri. It was very early when we started all these ideas and concepts of having IR specialty, IR services, teaching the public. We'll talk about this as well. But the concept of a clinic in a hospital was not there. So I think it's much easier now. So when you start, make sure you meet your patient in a proper clinic, not in an ultrasound room, not in a corridor. Make sure you have the proper setup. You need to look after your image. Image is very important. I intentionally added this image to demonstrate. You need to be well-groomed. You need to be well-dressed. You need to present or represent actually your specialty when you meet your patient. So first impressions are very important for patients, especially when they see them for the first time, as I said. Branding is something that you need to prepare also before starting your service. And it could be either your own brand, or if you're affiliated to a center or an institute, make sure that you have a brand. And of course, you need to make some hospital arrangements and your standard operating procedures. The hospital needs to know when the patient is coming, what happens when the patient arrives, what equipment are you going to use. All these things need to be well prepared before you start the service. As I said, it's not a presentation, it's a talk, and I will welcome a lot of your questions after we finished. Pricing is something that I really need to speak about because I believe it's important for our service and the continuity of our practice as well. It is related to the quality provision. We all know that we use a lot of non-reusable. It's things that needs to be thrown away after we're done, we're finished. We don't reuse it. Our stuff is very expensive. And if you start pricing your let's say, your procedure because you want to compete with other specialty, if you start using lower prices than surgery, you are likely to end up failing with the service itself. The reason is we are always having new technologies, new equipment, and the prices are increasing, especially with the inflation that we are encountering right now. So if you set a very low price for your procedure, you're destined to fail because you won't be able to keep up with using good quality material and providing a good quality service. When it comes to quality perception, when you go into a supermarket, I'm sorry, I have to use some analogies because this is something very important. When you go to a supermarket or when you want to choose any kind of service, if you see comparable items and there is one with the least price and one with the highest price, automatically you will assume that the one with the least price is the least quality. And when you compare your pricing as an IR service to other specialties as well, if you start, let's say we're doing IR for fibroids, what you're doing, if you start your practice by setting up a lower price than a myomectomy, then what you're saying is that I have a less value. I know it could be a little bit controversial, but a lot of patients perceive it as a lower skill, lower value service. Actually, we consume more embolics, catheters than the usual cost for surgery. So you need to be careful about your pricing. If you want to compete over price, there is always someone who's willing to offer a lesser price. So what I would advise you to do is always compete over value and not price. There needs to be a lower limit for any IR procedures. And this is my advice for the doctors who are starting this service. Some doctors assume that if they start a service with a very, very low price, they will be able to penetrate the market. Actually, they will be harming themselves on the long term. So pricing is something we need to discuss amongst ourselves in the community or in the society because it will affect our further progression. Marketing is something that is now common practice amongst IR, but I think when we started like 20 years ago, it was really difficult. You needed to publicly educate the patients about what is IR, what are we doing, who we are, what is the specialty, or what does it represent. And when you publicly educate patients, you need to be very sure that you're transferring or conveying the message in a very honest way. It needs to be also setting up a reasonable and realistic expectation for the patients. You don't give them any false promises that we're doing magic. So it's very important, public education, with public education. Websites, now it's a common practice, and I think it's very important to incur trust. And it has more importance now than just having a social media page. And it's something that needs to be discussed further. As I said, we will need some form of forum or a community to discuss all these points. I'm just scratching the surface because of the time limitation. So when it comes to webinars, it's also important if you can do it online, if you can do it in any social form such as social clubs. Professional services for copyrighted material, this is something that you will also need to have. Someone who needs to write your articles, and you need to revise these information before it is publicly announced. Now, I come to something that I was never taught or had dedicated training or information about, which is social and communication skills. Believe it or not, I would assume that more than 50% of your success as an intervention radiologist would depend on your communication skills, or social and communication skills. There is a book called Likability Wins. And if the patient doesn't like you, he might very likely to go to another doctor because likability is very important. You need to be a good listener, of course, and when it comes to ladies, you need to be a very good listener. So make sure that you have all the patients. Of course, empathy. You have to deal with the patient as a human being suffering from a problem, rather than look at her as a fibroid. She's not a fibroid that needs to be treated. She's a lady. Lady that needs the attention, you need understanding, you need to listen to her. And now we come to the patients. You need to be very patient with patients, avoid being provoked. This is one of the questions that I was asked that really provoked me, and I was about to answer the question whilst I was provoked. I had to calm down because the patient was assuming that I have very good experience with goat's milk. I'm not a vet. I don't have a goat in the backyard of my house. How the hell would I answer such a question? I was provoked. So you need to be very careful when you tackle these questions. And to make it worse, I got another question with a patient assuming that I know duck's egg size. She's asking you about how to compare the fibroid to the duck's egg. You'll also face cultural beliefs and religious beliefs. Some patients with fibroids still believe that it is related to genies. One of them is called the Jinn al-Ashiq. I never knew about Jinn al-Ashiq until the patient started asking me. They're assuming that I know. And I started asking them, so when I treat the patient and she's better and all the symptoms are gone after the uterine artery embolization, am I an exorcist? Did I take the genie out? So they still believe it's related to genie, and some of them still feel that herbal medicine has a big role in treating fibroids. You need to be aware of all these cultural beliefs and differences, and some of them, as I said, are religious, and you need to know how to deal with it and tackle it. Be careful with your wording. Some of us will need to depend on some of the social media specialists who will make offers, who will write some offers. You need to be very careful with your wording. Some of it might be offensive to patients. It's unintentional, but some of the wording can be really offensive. So make sure you choose your words carefully. Communication also doesn't stop after the procedure. Before the procedure, you need to be, as I said, a good listener. You need to prepare the patient mentally for potential complications and what to expect. You need to be very clear about your messages, about, as we said earlier, the reasonable expectations. Don't give any false promises. After the procedure, you need to be available. You need to provide a phone number. She needs to find you, the patient, whenever there is any kind of complication or worry. You need to be there for her follow-up. You need to have a follow-up schedule for her. And you need to display and express genuine care. Don't just consider her a number or a patient. She is a lady that needs follow-up and care. Now, to the point that I know a lot of the junior doctors tend to like, it's the procedure. I always consider the procedure a service. As I said, it's not a technique. And as I said, you need to have the proper knowledge and skills. You need to have a mentor, ask, attend conferences, etc. Being safe is one of the most important things for having a successful practice with fibroid embolization or uterine artery embolization. In the UK, we always have a pre-procedural checklist. We call it the WHO checklist or WHO checklist. You need to make sure that everything has been well prepared. The blood or labs the results are all there. Make sure that she's not at risk of any bleeding or allergies. And finally, you need to make sure that all the material required for the success of the procedure is available. Finally, when it comes to the procedure, I also want to make sure that we need to collaborate. We need to have our own forum, discuss our problems amongst ourselves as doctors and practitioners, and make sure that we share complications, experience, so that we make the next procedure safer. Your success is my success. Anything that would jeopardize the safety or the success of your procedure affects the whole practice, because patients don't see it as a personal problem. They see that the IR is not working, or it's just the procedure failed. So we need to make sure that we all contribute to each other's success. I don't have... So some of the important focus points, we've managed the communication skills, we've talked about it. The pre-procedure consultation also, it's very important. Analgesia. Analgesia is one of the very important things you need to discuss with your patient, and you need to make sure that the patients are well aware of it. Right now, I always use PCA pumps and preemptive analgesia. It's giving analgesics before the start of the procedure or before the pain kicks in. This is another topic that probably might need another talk or presentation, but I'm just scratching the surface over the important points. Particle size. You need to be very careful with your particle size and the type, because each type has a different particle size. And now we need to also consider, I've been using them, the new absorbable microspheres like Nexospheres. I prefer to use the bilateral approach. It saves time, it minimizes radiation, and it's much quicker. Radiation. I've had a dedicated talk about radiation before. Make sure you use or minimize runs. I always use fluoro runs now, and I use a lot of collimation to minimize radiation exposure. Make sure you're also protected. Having your shields, your thyroid, your aprons. It's very important for us to minimize risk for doctors as well. Follow-up is very important. Do not forget to give a follow-up plan for the patient. Now, to one of the most important things that I was hoping that we would talk about for years. It's the collaboration, not or over competition model. I'm hoping that we will create more opportunities than competing over existing cases. I want to encourage partnerships amongst intervention radiologists to expand possibilities. This is this is an image I'm trying to hopefully explain why we need to diversify our practice to start with. The block in the center could be a procedure. Let's say there is a new procedure that is gaining some popularity now, genicular artery embolization. What can happen is that everyone starts to focus on genicular artery embolization and try to compete and start the service, compete over pricing, make sure that he is the one who's starting it or practicing it. That is not how things should be, and I will explain as well now. Besides working or expanding the scope of our practice, adding new procedures, which is happening all the time, we need to make sure that we have covered the rest of the other procedures and make sure that we have some of us that are really, really focused on these procedures to make sure that they will become the specialists of these procedures. When it comes to seniors, I'm hoping that we can improve together our specialty image, and we can improve the results by collaborating together, and we can set some form of pricing models together so that it would benefit everyone. I'm giving also another example of how we can all together increase the market share. What I have seen over the years is that maybe we were not really able to collaboratively work together and to increase the market share. For instance, there was at some point, maybe 30 years ago, some public advertisement, not specifically done by a specific company, but it started by a company who wanted to make sure that the people were using, I don't know how to call it, packaged milk rather than free milk. And there was a campaign not for a specific product, but about changing the perception of the public. I'm hoping that at some point we can all collaborate in trying to publicly educate the patients that IR is a safe option. IR is a very efficient specialty in general. I'm not talking about a specific procedure. And once we improve our image and the trust in the public, we will have all more patients. So instead of having 100 patients a month, we can all have 1,000 patients a month. I'm hoping we will discuss this further because I think it will help all of us. I'm almost done. As I said, it will also help junior doctors to have better teaching, mentoring, and we can also add more patients to our younger doctors. Take-home message is IR is a practice. It's not a technique. Prepare for success. Be safe. Be likable to the patients. And, of course, make sure that all these points are covered. I'm hoping that we can also increase our communication. I've created an international radiology collaboration. I know that we are also hoping to revive the Egyptian Society of Intervention Radiology. And very soon, I'm hoping I will be contributing to an online teaching community and platform. That's all. Thank you very much for your attention.
شكرا دكتور سمير، وهنخلي الأسئلة للآخر إن شاء الله. احنا هنيجي اللايف ترانسميشن إن شاء الله.